Somewhere in your body right now, something quiet may be happening. Not painful, not dramatic, nothing that would make you stop what you're doing. And that's exactly the problem. Every year, doctors see patients over 65 who walk into a clinic for something completely unrelated, a follow up visit, a hip x ray, a routine blood test, and discover, almost by accident, that their heart has already been through something serious. Not a dramatic collapse, not the version we see in movies with someone clutching their chest and falling to the floor, something much quieter. Most people never notice it happening. And that's what makes this topic so important for anyone over 60, because after this age, the way your body warns you starts to change. The alarm system doesn't always ring the way it used to. Today, we're going to walk through 5 signs that deserve your attention. Signs that are often overlooked, mistaken for something else, or simply missed. Not to alarm you, but because awareness, especially after 60, can make a real difference. Let's start with why this changes so much once you pass this age. Here's something many people don't realize. The way a heart attack feels is not the same for everyone, and it's especially different for older adults. The version most of us picture, sudden crushing chest pain, is real, and it does happen. But what makes this dangerous is that it isn't the only version. And after 60, it's often not even the most common one. The body changes quietly with age. Nerve signals that once carried a sharp, unmistakable warning can become dulled or altered. This means a heart attack can happen with symptoms that feel more like tiredness, indigestion, or simply not feeling like yourself. Symptoms easy to brush off, especially if you're used to managing aches and minor complaints as part of getting older. If these signs are ignored or dismissed as just aging, there can be a delay in getting help. And with heart-related events, time matters. This isn't about frightening you. It's about understanding what to watch for, so that if something does happen, you or someone you love can act sooner rather than later. Before we go further, let's be clear about something important. This video is not meant to scare you. It's meant to inform you. Knowledge like this exists to help you notice changes early and have more productive conversations with your doctor, not to make you anxious about every ache or every tired afternoon. If you take heart medication, blood pressure medication, or any other prescribed treatment, please continue following your doctor's guidance. Nothing in this video should be used to start, stop, or adjust any medication on your own. Think of this as a foundation for better questions at your next appointment, not a replacement for medical care. With that in mind, let's talk about who's guiding you through this. I'm a medical educator with a background in cardiovascular health, and for years, I've worked alongside physicians helping patients understand exactly this kind of information, the changes that happen quietly in the body as we age, and why they matter more after 60. My goal here isn't to diagnose or replace your doctor. It's to translate what the research and clinical guidelines tell us into something clear, calm, and useful for real life. If this kind of practical, no-nonsense health education is helpful to you, consider subscribing. We publish videos like this regularly, focused on the kind of information that helps people stay ahead of health changes as they age, without the fear and without the jargon. Now let's talk about how aging actually changes your heart and your body's warning system, because this is the foundation for everything we're about to cover. Educational foundation: how aging changes the heart. Think of your cardiovascular system like a set of pipes and a pump that have been working without rest for 6, 7, 8 decades or more. Over time, arteries, the vessels that carry blood from your heart to the rest of your body, can become slightly less flexible. Doctors sometimes describe this as stiffening. A garden hose that's brand new bends easily. An old hose left out in the sun for years becomes stiffer, less forgiving. Something similar can happen inside blood vessels as we age. At the same time, deposits of fat and calcium, called plaque, can build up gradually inside artery walls. This is a process that can begin decades before any symptoms show up. It doesn't happen overnight, and it isn't caused by any single bad habit. It's a slow accumulation, influenced by genetics, diet, activity level, and time itself. Now here's the part that connects directly to today's topic. Aging also affects your nervous system, specifically the nerves responsible for sending pain signals to your brain. In some older adults, especially those living with diabetes, these signals can become less sensitive. This is sometimes called silent ischemia in clinical settings, a situation where the heart isn't getting enough blood flow, but the classic pain response is reduced or absent. This is why heart attacks in people over 60 and especially over 70 can look completely different from what we've been taught to expect. Understanding this shift is the key to recognizing the 5 signs we're about to walk through. Let's begin with the first one. And it's a sign that many people mistake for simply getting older. Sign number 1, unusual or unexplained fatigue. The first sign is one of the most commonly overlooked, a level of tiredness that doesn't match your activity. We're not talking about the normal fatigue that comes after a long day, poor sleep, or a stressful week. We're talking about a kind of exhaustion that shows up doing something simple, making the bed, walking to the mailbox, climbing a short flight of stairs, tasks that never used to feel difficult. Here's how this connects to the heart. When the heart isn't pumping efficiently, whether due to reduced blood flow or an underlying issue with the heart muscle itself, the body compensates in quiet ways. Oxygen delivery to muscles and tissues can become less efficient, and the result often feels like fatigue rather than pain. Aging changes how this presents because older adults often already expect to feel more tired than they did at 40 or 50. That expectation can work against you, masking a sign that would otherwise stand out. Research on cardiovascular symptoms in older populations has repeatedly pointed to fatigue as one of the more common yet most under-recognized warning signs, particularly in women. This doesn't mean every tired afternoon is cause for alarm, but a sudden unexplained change, going from having energy for your usual routine to feeling drained by it, especially over a short period of days or weeks, may be worth mentioning to your doctor. The practical step here is simple. Pay attention to patterns, not single days. If fatigue is new, persistent, and doesn't improve with rest, that's a conversation worth having. But that's only part of the story, because fatigue rarely travels alone. There's a second, closely related sign that often shows up right alongside it, and it's one people often blame on being out of shape. Sign number 2, shortness of breath. During ordinary activity, the second sign is breathlessness, but not the kind you'd expect from a sprint or a hard workout. This is breathlessness during activities that used to feel effortless. Here's what's happening inside the body. When blood flow to the heart is restricted, or when the heart muscle is working harder than it should to compensate for narrowed arteries, the lungs can be affected too. Fluid can begin to build up in ways that make breathing feel more effortful, even during light activity like walking across a room or getting dressed. Aging changes the way we interpret this. Many older adults naturally develop some reduction in lung capacity and cardiovascular efficiency over time, so a bit of breathlessness might feel expected. This is exactly why it's so easy to dismiss. What makes this sign worth watching is the pattern of change. If you find yourself needing to pause halfway up the stairs when you didn't before, or if simple chores leave you unexpectedly winded, that shift itself is the signal, more than the breathlessness alone. Clinical guidelines on heart health consistently list new or worsening shortness of breath as one of the key symptoms healthcare providers ask about during cardiovascular evaluations, specifically because it can indicate the heart isn't managing blood flow as effectively as it should. The practical advice here is the same as before. Notice change over time, and don't assume it's simply a normal part of aging without checking in with your doctor, especially if it happens alongside fatigue. This is where things become more important, because the next sign is the one most people associate with heart attacks, but it shows up in a very different way after 60 than it does earlier in life. Sign number 3, discomfort. Outside the chest, jaw, neck, back, and arms. The third sign challenges what most of us were taught to expect. We're conditioned to picture chest pain as the defining symptom of a heart attack. And while chest discomfort absolutely can happen in many older adults, and especially in women of any age, the discomfort shows up somewhere else entirely. This can include a dull ache or pressure in the jaw, discomfort spreading through the neck or shoulders, tightness across the upper back, or an unusual ache down one or both arms. Here's why this happens. The heart and certain areas of the upper body share overlapping nerve pathways. When the heart sends distress signals, the brain can sometimes misinterpret where that signal is coming from, a phenomenon called referred pain. Instead of clear chest pain, the brain registers discomfort in the jaw or back instead. Aging changes how this presents in 2 ways. First, as we discussed earlier, nerve sensitivity can shift with age, which may make these signals feel more like a dull ache than a sharp pain. Second, many older adults already manage some form of joint pain, arthritis, or muscular discomfort, which makes it easy to attribute new pain to an old injury acting up rather than something happening in the heart. This doesn't mean every ache in your jaw or shoulder is heart-related. Most of the time, it isn't. But when this kind of discomfort appears suddenly, doesn't have an obvious cause like a strained muscle, and especially when it appears alongside fatigue or breathlessness, it becomes something worth paying closer attention to. The practical takeaway: don't wait for pain to appear exactly where you expect it. If something feels unusual and doesn't resolve, mention it to a healthcare provider rather than assuming it's unrelated. The next point surprises many people because it doesn't sound like a heart symptom at all. Sign number 4: digestive like symptoms, nausea, indigestion, and upper abdominal discomfort. The fourth sign often gets mistaken for something in the stomach rather than the heart: nausea, indigestion, or a feeling of pressure in the upper abdomen. This connects back to those shared nerve pathways we mentioned earlier. The heart sits close to structures involved in digestion, and distress signals from the heart can sometimes be interpreted by the brain as coming from the stomach instead. This is particularly well documented in cases involving the lower portion of the heart. Aging plays a role here too. Digestive changes, slower digestion, increased likelihood of acid reflux, and greater sensitivity to certain foods are common as we get older. This means when heart-related nausea or indigestion-like discomfort appears, it's incredibly easy to reach for antacids and assume it's simply a stomach issue, especially if it happens after a meal. What makes this particularly tricky is that this sign is more commonly reported by women and by people managing diabetes, two groups where classic chest pain is often less pronounced to begin with. None of this means every case of indigestion is a cardiac event. The vast majority certainly aren't. But new, unexplained nausea or upper abdominal discomfort that occurs alongside fatigue, breathlessness, sweating, or a general sense that something isn't right deserves attention rather than dismissal. The practical guidance here is to notice context. Indigestion after a spicy meal is very different from sudden nausea that appears out of nowhere, especially paired with other symptoms on this list. This is where everything changes because the final sign is less about a specific location in the body and more about a general feeling, one that's harder to describe but just as important to recognize. Sign number 5: sudden cold sweat, lightheadedness, or a sense that something is off. The fifth and final sign is less specific, but often described by patients in strikingly similar terms: a sudden cold sweat, unexplained lightheadedness, or an overwhelming sense that something in the body simply isn't right. This happens because a heart under strain can affect blood pressure and circulation in ways that trigger what's called an autonomic response. Essentially, the body's automatic survival system kicking into gear. This can lead to sweating that doesn't match the room temperature or activity level, a lightheaded or dizzy feeling, or a sense of unease that's hard to put into words. Aging changes how reliable this signal feels because dizziness and lightheadedness already have several common non-cardiac causes in older adults: dehydration, blood pressure medication adjustments, inner ear changes, or simply standing up too quickly. This overlap is exactly why a cardiac-related episode can hide in plain sight, mistaken for one of these far more common and less serious causes. What tends to stand out, according to clinical observations, is the combination cold sweat and lightheadedness appearing together, especially alongside fatigue, breathlessness, or discomfort in the jaw, back, or upper abdomen we discussed earlier. It's rarely just one sign in isolation, it's often several appearing close together. The practical advice here is to trust that instinct. If something feels distinctly different from your normal aches, pains, or dizzy spells, especially if several of these signs show up around the same time, it's worth treating seriously and seeking medical attention rather than waiting to see if it passes. Now that we've walked through all 5 signs, let's bring this together. Let's quickly recap what we've covered, because after 60, these signs rarely show up the way movies and television have taught us to expect. Unusual fatigue that doesn't match your activity, shortness of breath during things that used to feel effortless, discomfort in the jaw, neck, back, or arms, not just the chest, nausea or indigestion like discomfort that appears without a clear cause, and sudden cold sweat or lightheadedness, especially when it shows up alongside the other signs. Individually, many of these can have simple, harmless explanations, but together, or when they appear as a sudden change from your normal baseline, they deserve attention. Here's the key lesson from everything we've covered today: your body changes as you age, and so does the way it communicates with you. The warning signals that once felt sharp and unmistakable in your 30s or 40s can become quieter, more easily confused with everyday aches, fatigue, or digestive discomfort. This isn't a flaw in your body. It's simply part of how the nervous system and cardiovascular system shift over time. Understanding this shift is one of the most valuable things you can do for your long-term health. This is exactly why regular checkups matter more after 60 than ever before. Not just annual physicals, but honest conversations with your doctor about any new or unusual symptoms, no matter how minor they seem. It's also worth periodically reviewing your medications with your physician or pharmacist, since some prescriptions can influence how symptoms present, and dosing needs can change as the body ages. Please remember, never adjust or stop any medication without guidance from your healthcare provider. The goal of this video was never to make you anxious about every tired afternoon or every twinge of indigestion. The goal is awareness, the kind that helps you notice a genuine change when it happens and gives you the confidence to bring it up with a professional rather than dismissing it. Getting older doesn't mean losing control over your health. It means learning to listen a little more closely and partnering with your doctor to stay ahead of changes rather than reacting after the fact. That's not something to fear, it's something to feel empowered by. If you found this information helpful, take a moment to like this video. It helps us know this kind of education matters to you, and it helps this reach more people who need it. Leave a comment and let us know if you or someone you love has experienced any of these signs. Your experience might help someone else recognize it in themselves. And if you haven't already, consider subscribing. We publish videos like this regularly, focused on practical, level-headed health education for adults over 60 and the people who care for them. Finally, if you know someone over 65, a parent, a neighbor, a friend who might benefit from this information, please share this video with them. Sometimes the most important thing we can give someone isn't advice. It's awareness, shared at the right time. Thank you for watching, and take care of that heart of yours.